25.
Let us get more reaction out to that story that broke just before we came on air. The news that Johnson & Johnson have paused the rollout of their COVID vaccine in the United States after several reports of an extremely rare type of blood clot. So far, there have been 6 reported cases out of the 6.8 million people there that have had a single dose jab. Johnson & Johnson are also delaying its vaccination rollout in Europe. As a result, Amish Adalja is an infectious disease expert at the Johns Hopkins Center for Health Security in Baltimore and joins us now. Amish, hello.
Hi, thank you for having me.
You're very welcome. What did you make of this decision?
I think it was an unfortunate decision. That what's going to end up happening is this pause is going to try and determine whether or not there is actually a causal linkage between the Johnson & Johnson vaccine and this extremely rare side effect. But what I fear the result will be is a lot more vaccine hesitancy, and it's going to be very hard to resume the Johnson & Johnson vaccine rollout, because what people are going to remember is just another bad headline about this vaccine. And I think it's just going to be very difficult. I think it could have been handled better. This could have been done without putting a pause in place, by really giving people the information that they needed, that this is extremely rare, that the risk-benefit ratio is not going to change, and this vaccine is safe and efficacious, despite this handful of rare blood clotting disorders that occurred in some people.
So there are plenty of parallels here between what happened with what has happened with Johnson & Johnson and what did happen with the Oxford AstraZeneca vaccine, and there were reviews of that by the European Medicines Agency and the MHRA here in the UK, and they decided that the benefits outweighed the risk. And that may well happen here with Johnson & Johnson, but isn't it ethically the right thing to do if there are, if there is any kind of issue at all with the jab? Isn't it the ethical thing to do, just to pause it to check? Because it would be easy to jump to the conclusion that it may be the same outcome as the Oxford AstraZeneca, but we don't know for sure, do we?
I think the ethical thing to do is to disclose it and to conduct an investigation and try and put it into full context. But it's not as if we have the luxury of time in this pandemic. We're trying to vaccinate people as quickly as possible. And I think that just looking at the data, knowing how rare this is just on first glance, I think you can still continue to say, let's move forward with the vaccination. At the same time, we're going to investigate. And if we're going to do a pause, why not restrict it and pause it to those individuals who are maybe women of childbearing age, which is where those 6 cases occurred, instead of kind of coming up with a blanket pause, because they're going to restart this. We know they're going to restart this in a couple of days, and they're going to say the risk-benefit ratio favors the vaccine. But all the ensuing damage that's been done in terms of vaccine hesitancy, I think, is not going to be easily reversed.
Yeah, and again, that's another parallel here, because anecdotally, people are choosing not to have the Oxford AstraZeneca vaccine. Some anyway, when they're offered it, they're walking out of the vaccine centres. The stats here, Amish, are in the region of 1 in 250,000, the level of risk, certainly according to the MHRA, which is 0.0004%. And we were told by a minister here that it's the equivalent of a blood clot after having a transatlantic flight. From 6 reported cases out of 6.8 million, can we extrapolate the same? Is it going to be the same level of risk, do you feel?
It's going to be even probably lower, I think, with this Johnson & Johnson vaccine than the AstraZeneca vaccine. Certainly lower than the risk of blood clots from getting natural COVID-19, or lower than the risk of blood clots from oral contraceptives. Probably lower than the odds of getting into a car accident on the way to get the vaccine. So I think that we've got to get better at making risk calculations and putting risk into perspective, because you can't just do this type of a pause and not think about what this is going to mean. And we seem to have not learned from the European experience with the AstraZeneca vaccine, because many of us in this country warned that it was the wrong decision that the EU made to pause some of the vaccines in some of those European countries, and it was going to lead to vaccine hesitancy. And now the exact same thing is repeating here in the United States, as if this whole incident with the AstraZeneca vaccine didn't happen. But I think what happens is regulators are very much incentivized to be risk averse and to do things, quote unquote, under an abundance of caution. And anytime you hear someone use the word abundance of caution, that tells you something probably is being done not for a real scientific reason, but more for an optical reason, in trying to really be risk averse. That's what we saw during the Ebola outbreaks in the United States. Lots of things done for an abundance of caution that didn't make sense. And this is another example of that to me, that this is going to cause damage. And I think the Johnson & Johnson vaccine is going to have a hard time coming back from this.
Just a final word. Is there a financial aspect here? Do Johnson & Johnson have any kind of federal waiver on lawsuits? They may be thinking, well, this is a process we need to go through in order to save expensive litigation further down the line.
Well, I do. The vaccine manufacturers are indemnified for a lot of what they're doing now during this pandemic response, and this is a government response. Johnson & Johnson is an Operation Warp Speed vaccine that was developed with taxpayer funds, so there is a lot of that at play. But I think right now, just looking at it makes a lot of us scratch our heads understanding what the justification was for this, when it could have been done in a much better way, with maybe pausing it for women of childbearing age and continuing to study this without derailing the entire use of this vaccine. Which I think is going to be irreparable.
Okay, well, we'll see. Amish, listen, good to talk to you. Thank you, Amish Adalja there, an infectious disease expert at the Johns Hopkins Centre for Health Security in Baltimore. As we heard, then Johnson & Johnson has paused its rollout of its vaccine in the United States and in Europe while those incidences of blood clots are reviewed. Right,